I'm Bianca Weinstock-Guttman, and I'm professor of neurology at Jacobs School of Medicine and Biomedical Sciences in Buffalo, New York. And we'll talk today about early diagnosis in multiple sclerosis and the importance to relation to initiation of disease-modifying therapy. So why is an early diagnosis important? Early diagnosis and initiation of treatment have the potential to slow the course of MS over time. As you can see in this graph, there is a delay on disease progression and early diagnosis with early treatment versus later diagnosis and treatment, and clearly much better than the natural course of MS without treatment. Revision to the MS diagnosis criteria over the past 2 decades had facilitated earlier diagnosis by including MRI benchmarks, and most recently, the inclusion of oligoclonal bands in spinal fluid to support the essential feature of MS diagnosis, dissemination space, and time. In a recently evaluated cohort of 785 persons with MS from 9 European centers, the median time to diagnosis was almost 60 months when based on waiting for a second clinical event versus only 13 months based on the 2010 McDonald criteria and 3 months only based on the newer 2017 McDonald criteria. Earlier diagnosis, consequently, has resulted in earlier treatment, even based on differences between 2010 and 2017 criteria, which is associated with improved clinical outcomes for people with MS. A Swedish study evaluated 639 patients diagnosed with MS from 2001 to 2007, with a follow-up time was around 8 years. In a Cox regression models that was applied to this cohort to try to identify factors correlated with the outcome variables, and primarily looking for irreversible score of 4 of the expanded disability status scale, means patients with damage, irreversible neurological damage, but still able to walk 500 meters. And the result of this study suggesting the patient initiated on treatment later had a greater risk of reaching EDSS of 4. This risk increased with 7.4% for every year of delay in treatment. Patients who started treatment after 3 years from MS onset reached the outcome much earlier compared with patients that were starting treatment within 1 year. Baseline EDSS and age at onset were also found to be predictive factors of disability progression. So in conclusion, early treatment initiation was associated with better clinical outcomes. In addition, the study confirmed the well-established prognostic factors of late age of onset and early disability. Another study, retrospectively evaluating the Danish registry, compared the outcome between patients started early on DMT within first 2 years versus the ones over 2 years. Patients who started treatment with DMT later reached an EDSS score of 6, meaning requiring a cane on ambulation, more quickly, or almost 42% increase in hazard ratio, compared with patients who started earlier, and the delay in treatment initiation showed a tendency to shorten the time to death. So mortality was actually increased by 38% in the group that initiated treatment later. In addition, a more recent study evaluated the association of receiving very early treatment with the risk of lung disability, including also the MRI data. The MRI data was included in the MR score with 1 to 5 based on number of lesion, location, presence of gadolinium-enhancing lesion in the patient with the first immediate event on clinical isolated syndrome. Comparison between 3 groups were done, patients treated within 6 months, between 6 and 16 months, and over 16 months. A very early treatment decreased the risk of reaching EDSS of 3, decreased the risk to convert to secondary progressive MS, as well as decrease in sustained disease progression at 12 months after treatment initiation when compared with the patient from the delayed treatment group. Patient from the first group had a low disability progression to lower severe disability measured by the patient-determined disease step than those from the third group. So treatment initiation at very early stages, even after the first clinical event, was associated with a reduction in the risk of long-term disability accrual. So in conclusion, the new McDonald criteria provide an earlier diagnosis of multiple sclerosis. Earlier diagnosis offers the opportunity to initiate earlier treatment. Earlier therapy initiation delays long-term progression. And follow the specific criteria recommendation is actually very important to prevent misdiagnosis. Thank you very much for listening.